The role of family in borderline personality disorder, BPD, treatment, improving communication and reducing conflict in family dynamics. Borderline personality disorder, BPD, is a complex and challenging condition that can have a profound impact on family dynamics. Individuals with BPD often experience intense emotional instability, fear of abandonment, and impulsive behaviors, which can create a lot of stress and tension in their relationships. The way family members communicate, set boundaries, and respond to emotional crises can either contribute to conflict or foster an environment of support and understanding. In this episode of the Borderline Personality Disorder, BPD, podcast, we will explore the role of family in BPD treatment, focusing on how families can improve communication and reduce conflict. By learning how to engage in healthier interactions, family members can help create a more stable and supportive environment that enhances the healing process for the individual with BPD. 1. Understanding the impact of BPD on family dynamics. BPD can significantly affect the relationships between the individual with BPD and their family members. Due to the emotional intensity and fear of abandonment often felt by those with BPD, family members may find themselves walking on eggshells or becoming increasingly frustrated by their loved ones' unpredictable emotional responses. These dynamics can lead to a cycle of conflict and miscommunication, which only intensifies the emotional turmoil experienced by everyone involved. Key fact: the emotional volatility in BPD can create a pattern where family members react to each other's emotions rather than addressing the core issues. This can lead to feelings of helplessness, anger, and resentment among both the individual with BPD and their family. 2. Improving communication within the family. Effective communication is one of the most important skills for families dealing with BPD. When family members learn how to communicate in an open, non-judgmental, and empathetic manner, it reduces misunderstandings, promotes emotional validation, and helps de-escalate situations before they escalate into conflict. 2.1 Active listening. Active listening is a key component of healthy communication. It involves listening attentively to what the other person is saying without interrupting, judging, or offering solutions immediately. In families dealing with BPD, this is especially important, as individuals with BPD often feel misunderstood or dismissed. When family members listen actively, it helps the person with BPD feel heard and validated, which can reduce emotional volatility. Example: if an individual with BPD expresses feeling abandoned, a family member might respond by saying, "I hear that you're feeling hurt and rejected. That must be really painful for you." This shows empathy without minimizing their feelings. Key fact: active listening helps reduce defensiveness and misunderstanding. When family members feel heard, they are more likely to engage in calm, productive conversations rather than escalating the situation. 2.2 Non-defensive responses. Family members often feel defensive when confronted with intense emotions or accusations from a loved one with BPD. However, responding defensively can escalate the situation and create more tension. Instead, family members can try to respond in a non-defensive and compassionate manner by acknowledging the emotions of the person with BPD without becoming reactive. Example: if a family member is accused of neglecting the person with BPD, a non-defensive response could be, "I can see that you feel neglected. Let's talk about what happened and how we can avoid that in the future." Key fact: responding with understanding rather than defensiveness helps to prevent the situation from escalating and encourages more open, honest conversations about emotions and needs. 2.3 Setting clear and consistent boundaries. Individuals with BPD often struggle with boundary issues, either pushing boundaries or feeling rejected when boundaries are set. Family members need to set clear, consistent boundaries while still providing emotional support. Clear boundaries help create a stable environment for the person with BPD, giving them a sense of security and predictability. Example: a family member might say, "I understand you're upset, but it's not okay to yell at me. Let's take a break and talk about this when we're both calm." Key fact: consistent, respectful boundaries allow the individual with BPD to understand what is acceptable behavior, reducing the likelihood of emotional outbursts and creating a more balanced family dynamic. 3. reducing conflict in family dynamics. BPD often leads to intense relational conflict, especially when family members are unsure how to respond to the individual's emotional volatility. By adopting strategies that prioritize calm, compassionate responses and emotional regulation, families can reduce conflict and create a more stable and peaceful home environment. 3.1 De-escalating emotional crises. Individuals with BPD often experience emotional crises that can lead to outbursts or impulsive behavior. In these moments, family members can play a key role in de-escalating the situation by remaining calm and non-reactive. It is important to validate the person's emotions and give them space to express themselves while also setting limits on harmful behaviors. Example, if the individual with BPD begins to engage in self-harming behaviors, the family member should focus on emotional support rather than reacting with anger or panic. A calming response might be, "I can see that you're in a lot of pain right now. Let's focus on getting you the help you need." Key fact: remaining calm during an emotional crisis helps to reduce tension and escalation. It provides the individual with BPD with the emotional space to feel validated without fear of rejection or punishment. 3.2 Focusing on the present, not the past. Family members may be tempted to revisit past arguments or blame one another for mistakes. However, this can keep conflicts ongoing and prevent resolution. Instead, focusing on the present situation and finding solutions helps create forward momentum and reduces unnecessary conflict. Example, if a family member with BPD is upset, instead of focusing on previous mistakes, the family member can say, "Let's talk about what we can do now to help you feel better." This helps move the conversation toward finding solutions rather than rehashing old grievances. Key fact: focusing on the present moment and creating a solution-oriented approach helps reduce ongoing conflict and encourages a collaborative effort to resolve issues together. 3.3 Teaching emotional regulation within the family. In family therapy for BPD, families can learn how to teach emotional regulation skills and coping strategies to each other. This can involve practicing calming techniques, such as deep breathing, mindfulness, or timeouts to help manage stress and avoid emotional escalation during difficult situations. Example, if a family member with BPD is becoming overwhelmed, the family might practice mindfulness techniques together or agree on a signal for when someone needs a break. This shared effort creates a sense of unity and promotes calm within the family. Key fact: teaching emotional regulation as a family provides a sense of cohesion and mutual support, which is especially important when dealing with the emotional intensity of BPD. 4. The role of family therapy in improving communication and reducing conflict. Family therapy plays a key role in helping families develop the skills necessary to improve communication and reduce conflict. Family therapy is a space where family members can learn about BPD, discuss their feelings in a safe environment, and work together to strengthen their relationships. 4.1 Education about BPD. Family therapy provides education about BPD, allowing family members to understand the emotional struggles their loved one faces and how they can support them more effectively. This knowledge helps reduce misunderstandings and encourages more compassionate responses. Key fact: understanding the symptoms of BPD and the emotional pain that accompanies the disorder allows family members to approach their loved one with empathy rather than frustration or fear. 4.2 Learning conflict resolution skills. Family therapy helps families learn how to resolve conflicts in a healthy and constructive way. Families learn how to express their needs and frustrations in a way that is respectful and promotes mutual understanding, rather than escalating tensions. Key fact: conflict resolution training in family therapy helps family members manage disagreements without resorting to destructive behaviors or creating emotional distance. 5. Conclusion. The role of family in borderline personality disorder, BPD, treatment cannot be overstated. By improving communication, setting healthy boundaries, and learning how to de-escalate emotional crises, family members can significantly reduce conflict and help create a more stable environment that supports the healing process for their loved one with BPD. Family therapy is an essential tool in achieving these goals, offering a space for families to learn, grow, and support one another. By fostering a compassionate, understanding, and supportive environment, families can play a pivotal role in the recovery of individuals with BPD. As they strengthen their communication skills and reduce relational conflict, they contribute to a healthier, more stable future for everyone involved. In future episodes, we will continue to explore family therapy techniques, communication strategies, and how to foster positive change in family dynamics when dealing with BPD. Stay tuned for more insights on borderline personality disorder and how families can support healing and growth.